welcome everyone. We appreciate you guys being here today for the 2025 Impact Report put on by us, Canadian Women of Color Leadership Network and friends. We wanted to provide this information to you guys to be able to let you know the work that we've been doing since 2023 on Black maternal health and reproductive justice. We think it's vitally important for Black women's health, mental health, reproductive health, and to give that support, but also give that information to the folks who live in Ottawa, but also beyond Ottawa. And so we're super happy that we were able to build this framework out and really implement this into the work that we're doing here at CWCLN. This work does belong under our pillar of wellness. As some of you may know who participate in our programs, our wellness pillar consists of mental health and wellness, sexual health and reproductive issues, also the socioeconomic health and well-being of Black and racialized women and femmes. And so this work is now progressing, and we just wanted to give everybody who connects with us a fantastic update. You'll be able to see some slides, and we're going to be able to have our guest speakers come in, which is Kimberly Okafor. She'll be here with us presenting shortly. I am going to pass it to my colleague, Danielle James, to give the land acknowledgement.
Good morning, everyone. As we gather today, we acknowledge with deep respect the ancestral lands of the Algonquin Anishinaabe peoples, along with all First Nations, Inuit, and Métis peoples, whose lands we are privileged to stand upon. We honor their enduring stewardship of these lands. The Canadian Women of Color Leadership Network recognizes that our office is located on the unceded and unsurrendered territory of the Algonquin Anishinaabe Nation. We express our gratitude for the opportunity to be present here today, and we reaffirm our commitment to working in solidarity to improve the lives of our diverse communities on this shared land. CWCLN is dedicated to the ongoing process of decolonization and fostering meaningful partnerships with Indigenous communities. We also take a moment today to honor, acknowledge, and give thanks to our ancestors, those who came before us, stretching back through time to those proud African queens and kings from whom we are all descended. We remember our roots and all our brothers and sisters of African, Caribbean, and Black heritage who laid down the path we now walk. We remember our shared heritage, we celebrate our great diversity, and we acknowledge the struggles our mothers and grandmothers overcame so that we could be present today. Today, we are the vessel of all their hopes and dreams. May their hands be on our shoulders as we do this work.
So, kind of how it all began. As you guys know, CWCLN is going into our 7th year, and we've just been expanding on some of the work that we've been doing. We started in 2018, noticing that there was a significant gap for Black and racialized women and femmes, not only in the city of Ottawa, but across Canada. So this organization is dedicated, and our ministry is to be able to produce programs and services for Black and racialized women and femmes. So some of the work that we started to jump into around this was in 2023. We noticed a significant gap in the space when we were talking about everything from when you're a young woman and you are going through getting to have your menstruating all the way up to menopause. So, you know, from a young age to when you're an experienced woman. We noticed the significant gap of information. The data was not there. There was no clarity. And so we just decided to dive into this work, noticing also that Black Maternal Health Week is in April. That's more celebrated with our counterparts in the US and UK, but we didn't really see a significant acknowledgement here in Canada. And so we started this work in 2023. During our Empower Her workshop series, we had some different conversations around birth and birthing people. So this is some of the work that we did. We started with conversations with Danielle being a former doula. It was a great conversation and just understanding what a doula does. And a lot of people did not know, and they did tune in. It was an IG live that we did, and so it was some great information. Not only, you know, what a doula does in the birthing room, but also how to become a doula, the mentorship of it, and also how to start a business. So that was a great conversation. We also had a couple of other conversations in 2023 with two great women, Natalia Mason and Delilah. We did an anti-racist sex ed conversation. If you wanted to go back and look at that, it is still on our Facebook page. And then the same time, a couple weeks later, we did a conversation with four wonderful women, Jacqueline Saint-Laurent, Karen Cohen Sanchez, and of course, Delilah and Natalia came back for In Pursuit of Reproductive Justice. And of course, we talked about the urgent need of equitable reproductive care, comprehensive sexual health education, and policies that center around Black women's experiences. In October of 2023, again, the Empower Workshop series was there and dedicated to honoring our bodies. In 2024, we continued the conversation and continued the work. As we were expanding the work, we had decided to go and ask the City of Ottawa for a proclamation to acknowledge Black Maternal Health and Reproductive Justice Month. And notice, we don't only celebrate it for the 1 week in April, we expanded that information and that work to the entire month of April. We wanted to ensure that we raised awareness across the city, so we asked for the proclamation and we did receive it. We also did another conversation with Danielle and some great folks from Mom First. It was the equity and economic empowerment conversation, and it was really about becoming a mompreneur and also the details of how you could be a doula, but also start your doula business. And then we also had a couple of different drop-ins talking about Black maternal health and reproductive justice and how we could support Black moms and Black birthing folks. And so that was in 2024. And then, of course, our purpose and, of course, our goals. As we continue to expand the work and in alignment with our wellness pillar, like we had talked about, Black maternal health and reproductive justice was formed to address the ongoing disparities and barriers impacting Black women and femmes. The working group is dedicated to advancing Black maternal health and reproductive justice through research, advocacy, and our community programs. Our goals are to establish April as Black maternal health and reproductive justice month across Canada, advocate for inclusive maternal health care, data collection, and systemic change, and support the health and dignity and rights of Black women and birthing people. These are the three pillars where we're going to be advancing the work. So of course, it's advocacy and policy change. We want to drive systemic reform through policy, advocacy, and municipal proclamations and legislative actions, grounding the community-led research and disaggregated data that reflects the realities of Black and racialized women and femmes. The other pillar would be community mobilization and education, raising awareness and building collective power through storytelling, peer learning, public campaigns, and culturally grounding workshops that empower Black and racialized women and femmes. And then the third pillar is capacity building and the workforce development, strengthening the maternal health and workforce by supporting Black doulas, peer educators, and community leaders through training and mentorship and leadership development. This is our working group. So we have an amazing working group. We do have Erica Kamikaze from Ottawa Public Health who has joined us. Part of our team now and who is on our team is Danielle James, a former doula, but also a great mentor and educator. And then we had Doula Deb, that is actually her first name, Doula. Doula Deb was a research student and she was studying social work. She wasn't able to be with us here today, but this is the amazing working group that we've put together as we continue to do this fantastic work to be able to bring you resources, programs, and services to lead this work throughout the city of Ottawa and of course, as we connect with others across Canada. So some policy stuff that we wanted to work on because we vitally think it's important. Conversations have been happening not only with the city of Ottawa, but we've been having conversations with MPPs and MPs across Canada to be able to get to our goal, which is to have Black Maternal Health and Reproductive Justice Month declared across Canada. We believe it's vitally important to acknowledge this, not only for ourselves, but for the young women and the young generations coming up behind us to be able to say that this is an important matter and it's going to be taken seriously. And the data gaps that are out there are going to be looked at and filled. So, vitally important work. Our advocacy has resulted in being able to obtain proclamations from 5 different cities, but also lighting up the city lights in the city of Vaughan. So the proclamations that we were able to receive, of course, the city of Ottawa, Cornwall, London, Kingston, Timmins, and Barrie. All great places. They've all jumped on board. They've all said yes to be able to, get this passed and just look at the dynamics that we are going through to be able to say, yes, this is important work. We continue to advocate on the issue. I've already met, like I said, with a number of different MPs to be able to declare this and get this permanently declared across Canada. Again, these are the proclamations. And of course, these slides will be available to folks at the end of June. So you'll be able to see how many proclamations we were able to receive. And of course, as we continue to do this work, we're going to be talking to other cities, not only in the province of Ontario, but across Canada. The research and the data gaps are significant. We see our academic research, researcher Dula Deb from the University of Ottawa performed an environmental scan and literature review to identify gaps in Canadian mental health and data. Since Canada lacks the disaggregated data and research, CWCLN has been looking at the UK and the US research in order to better understand the disparities faced by Canadian women of color. With over 46 citations compiled from the US and the UK and other global sources, data does suggest that the health disparities impact Black women at every stage of their reproductive lives and well into menopause. Our research helps to inform and advocate and allow for us to be able to identify this and be able to close those gaps. I want to be able to bring forth our wonderful presenter, which is Kimberly Okafor. Kimberly is a dedicated researcher and advocate for maternal health and equity, currently pursuing a Master of Science in Management at Toronto Metropolitan University as Vice President, external for her master's cohort, and an active member of the Black Research Initiative to Empower BRIGHT. She is committed to addressing systemic challenges in maternal health care globally. Her research explores the intersection of maternal health and social inequities, aiming to transform healthcare systems and promote culturally competent and equitable care. Through her work, she strives to influence policy that drives meaningful change in maternal health. So Kimberly, over to you.
Thank you so much for the warm welcome. I really do appreciate that. So briefly start. My name is Kimberly, and I'm honored to be here today to present a topic that is both timely and critical. And my presentation today is focused on empowering maternal health by tackling postpartum challenges and advancing equitable care. I also want to express my gratitude to all the organizers today for the opportunity to speak here. But before I begin, I would also like to provide a brief disclaimer. Earlier this year, I presented at Black Women's Aligned with Katongwa Nimoyo, and this presentation is an alternative presentation which focuses not on prenatal care, but postpartum care, along with its intersection with race, socioeconomic status, and access to healthcare services for Canadian mothers. So moving forward, to briefly start, here is the presentation outline for today. We will cover more of the introduction into postpartum depression, along with understanding what it means within the maternal healthcare sector. We will cover the disparities in maternal health outcomes, the gaps in Canadian research, along with socioeconomic factors and postpartum depression. We will also tackle the role of trauma and the role that it plays in postpartum depression, the need for culturally competent care, along with the research imperatives that are needed for Canada. So to briefly start, postpartum depression, also referred to as PPD, is a serious mental health condition that affects mothers typically during the first year after giving birth. And it is a public health issue that impacts both maternal well-being and childhood development. And while postpartum depression can affect mothers across all racial and ethnic backgrounds, research consistently shows that Black mothers are disproportionately affected. And my presentation today will explore how factors like race, income, and systemic racism contribute to postpartum depression among Black Canadian mothers. So postpartum depression is more than just feelings of sadness or exhaustion. It includes persistent symptoms of anxiety, irritability, fatigue, and often difficulty bonding with the baby. And although postpartum depression can affect mothers of all backgrounds, research shows that Black mothers experience significantly higher rates. For instance, between 29 and 44% of Black mothers report postpartum depressive symptoms. Now, this rate is much higher than that of the other racial groups, and these findings really highlight the importance of understanding the unique risks that Black mothers face in Canada. So in the United States, research shows that Black women are 3 to 4 times more likely to die during childbirth than their white counterparts. And research also highlights that Black mothers are also more likely to experience factors like high blood pressure, which is preeclampsia during pregnancy, and to give birth prematurely, both of which can contribute to postpartum depression. Although these findings are based on studies that exist in the United States, similar disparities may exist in Canada, and that is why it is important for us to understand why the collection of race-based data is important here. So in Canada, the absence of comprehensive race-based data makes it quite challenging for us to understand and address disparities in postpartum care. Without disaggregated data, it is quite difficult to explore how racism and ethnic background, along with socioeconomic status, affect postpartum health outcomes. And currently, research highlights, as I mentioned previously, that Black mothers are more likely to be hospitalized for postpartum depression than mothers from other racial groups. So this suggests that systemic barriers, including lack of early intervention and culturally safe care, may contribute to worsened outcomes for Black mothers. And that is why in Canada, despite the fact that we don't have research, we can look at similar healthcare systems. For instance, in the UK has a similar healthcare system where they provide free healthcare for their residents. And unlike Canada, the UK collects race-based data, and based off of that, their stats are actually similar with the States, with the same Black maternal mortality rate. So even though we have different healthcare systems, we can also look at other nations that have similar systems and try to understand the trends that would most likely exist in Canada. So moving forward, research also shows that socioeconomic factors are strongly linked to postpartum depression. For example, low-income mothers are significantly more likely to experience postpartum depression compared to high-income mothers. Now, there are a variety of other factors that may intersect and overlap with one another, which is why it's also important to recognize that mothers are not monoliths and that it's important to look at things from an intersectional lens. And there was also a 2015 study that found that approximately 19% of postpartum mothers experienced depression within the first 3 months after childbirth, and almost 48% of low-income mothers report elevated postpartum symptoms. For Black mothers, these socioeconomic challenges are often compounded by other factors like systemic racism, limited access to culturally competent care, and discrimination. So together, these factors create additional barriers to seeking and receiving mental health support. Now, we're moving on to the role that trauma plays in postpartum depression. And based off of a lot of research papers, it shows that Black mothers are often more likely to experience trauma during childbirth. According to a 2022 study, the authors found that Black mothers report the highest levels of trauma during pregnancy and childbirth, which is a significant risk factor for postpartum depression. And this trauma can result from experiences such as being dismissed by healthcare providers, having their concerns ignored or dismissed, or often facing discrimination in medical settings. Overall, this highlights the need to address systemic issues within maternal care. It is also important to note that Black mothers face significant barriers in accessing culturally safe maternal and mental health services. They are more likely to be hospitalized, as I mentioned previously, which suggests that early community interventions are often lacking. And that is why in Canada, it's important for us to ensure that we have culturally competent care so that we're able to provide a safe space for Black mothers during their prenatal, but also postpartum period. And culturally competent care involves recognizing the impact that racism has, but it also involves validating lived experiences and providing care that is both respectful and responsive to cultural needs. And anti-racism must be a core principle in the design and delivery of postpartum care services. So moving forward to now the research imperatives for Canada. Canada must prioritize the collection of race-based data to gain a better and deeper understanding of how race affects maternal health outcomes. The research should also explore how other factors like socioeconomic status, immigration status, even geographic location can often intersect with one another and shape postpartum experiences. Lastly, we need to listen to the voices of Black mothers by acknowledging their stories and involving them in the development of care models and policies to ensure that solutions are relevant and effective in this case. So overall, to conclude, Black mothers face often unique compounding risks during postpartum. And it's important that we address these. We don't push them aside, and we ensure that we're giving Black mothers the space to freely discuss and talk about their experiences. There's so many other factors that I was not able to talk about today that often affect postpartum depression, but the major ones, as I mentioned previously, were systemic racism, socioeconomic status, and not having culturally competent care. And addressing these disparities is not only a matter of health equity, but it is also a moral imperative. And by prioritizing research and data collection, we can work towards a future where all mothers can receive the support that they need to thrive. So that brings us to an end of the presentation today, but thank you once again for having the opportunity to speak with you. It's been truly a pleasure, and I hope that this presentation has helped you provide more insights into how postpartum depression affects mothers. Thank you.
Thank you so much, Kimberly. We appreciate all the information that you were able to give us this morning. I'm going to pass it over to my colleagues, both Erica and Danielle.
So my name is Erica Kamikaze, and I am a community engagement coordinator with Ottawa Public Health, part of a team called the Community Engagement Team. So I've been working closely with the Canadian Women of Color Leadership Network as 1 in 4, as Sophia mentioned, working on Black maternal health working group. And a bit of our goals, or part of the goal of the working group, is hosting health promotion workshops on topics like heart disease, diabetes, cancer screening, SDBBIs for Black women and femmes. And we're actually starting a new workshop series in partnership with Fatima from the AIDS Community of Ottawa and Azizat from Somerset West Community Health Center. And we're looking at the intersection between SDBBIs and maternal health. So please continue to look at our website and Instagram, and the dates will be shared soon for July. Our shared goals is really to create accessible spaces rooted in the experience of Black women and femmes while building community connection, but also kind of partnership across the health system. And we have great partnerships with folks working with cancer, diabetes, cardiovascular health. and STBBIs, but one of the challenges we're facing is finding Black women or femme healthcare professionals to lead some of these workshops, especially when it comes to cancer, diabetes, and cardiovascular health. So the gap really highlights why representation in healthcare leadership is important and why investment in Black health expertise is also necessary. We also know that data, as mentioned by Kimberly, but also the research that Dula did, data drives better care. It's only, but it's also important to collect it and use it ethically with community trust. The collection of race-based data is quite important, and I wanted to highlight that there's a consensus statement on race-based data for health, which is a powerful commitment from health leaders across Ontario, including OPH. And it calls for community-led transparent data collection, which is a real investment to turn insight into action. So we are really excited for it because we did see that during the pandemic, COVID-19, race-based data did help us in general reveal not only disparities in infection rates, the impact of it, but also data led to changes that made response more equitable. I can speak on it specifically with the work that we did at OPH and that the community engagement team did. I also wanted to highlight an example of how sociodemographic data can turn into action, and that it can impact maternal health. So at Ottawa Public Health, between November 2022 and October 2024, the Healthy Baby, Healthy Children program, which is a home visit program to support families with additional needs. They estimate that they were able to collect sociodemographic data for about half of all the people admitted to the program. And when they invited 929 clients to provide their sociodemographic data, 92% said yes, which is around 853 individuals. So the data tells us a powerful story, even if it was not qualitative, is the data in itself, but it still gives us an idea of who we're serving and who and how we can better service them. So 69% of the families were not born in Canada, and of those, 70% had been in Canada in less than 5 years. And of those newcomers, 94% identified as racialized and half identified as Black. So the data does confirm what many of the public health nurses working with the families were saying, especially with the families, the kind of barriers that they were facing relating to income, to housing, which was a big one, and unique challenges faced by newcomers as well. These are really complex systemic issues, of course, and addressing them requires a lot more collaboration across sectors, but it's still good and great and affirming to see that data does validates what we're saying, but it is important to have that. Like I said, it validated some of the public health nurses were saying, but it also permitted them to adapt some of their service, specifically related to being part of cultural affirming care, but also having folks that spoke the languages of the clients that they were servicing. So Arabic, Mandarin, Lingala, Swahili. Those were some of the languages highlighted on top of French and English. They also trained their teams in tools like cognitive behavior therapy, and motivational interview to better support diverse need, which once again, mental health, and especially in postpartum, is quite important. And they were also able to collaborate with partners from the Ottawa Health team to help clients be connected to primary care, which was one of the big gap as well. And it also started a lot of internal conversation about housing as health issues. Data really matters. It's not just numbers on a report. It helps us deliver more responsive, more equitable, and more community-centered care. And when we collect data with intention, of course, and people are willing to share it because they see that it can lead to real changes. So we are really happy. I'm really glad to be collaborating with CWCLN on this to center more Black voices and collecting not only partnerships so we can be of a service, honestly, to Black women and femmes.
Thanks. So under the pillar of wellness and economic empowerment that Sophia was mentioning before, we're looking to increase the number of Black and racialized doulas in Ottawa and across the country. I came on to this work a few years ago, as Sophia mentioned, doing some interviews and having these conversations. I'm a former birth and postpartum doula, DONA certified. I had a company named National Capital Doulas here in Ottawa, and we serviced people across the National Capital Region, families. And so this is kind of what led me to this work. And so part of what we're doing here is trying to build a network of trained, supported Black doulas in Ottawa and across Ontario to support Black and racialized women and femmes and their families. Part of what we've been doing has been issuing a bilingual survey where we asked people about their knowledge about doula, if they were interested in doula care, doula support. One of the things that we learned is that there was actually about 27% of respondents were unaware, unfamiliar with doula support. So again, like Erica was saying, data speaks. We see that there's a need there to maybe raise awareness about what doulas can do. I've come onto the team as the engagement and learning coordinator. And so for me, this year is really about building connections, meeting a lot of you folks, seeing the other work that's happening out in community. I've been meeting with other Black doulas, researching and reaching out to other organizations like Black Women Aligned, the Black Doula Society of Ontario, the Black Fertility Agency, Rooted Birth Work Collective, the Ottawa Birth and Wellness Center. So just starting to form those relationships, seeking alignment with other organizations, and trying to build those relationships right now. We have applied for funding to support training and mentoring new doulas and to provide peer support to new doulas who are, again, becoming a doula. You need a support network. It's difficult work. It can be challenging. And so CWCLN really sees a need for that. We want to be able to support Black and racialized families as well. So again, with peer support and just seeing what the needs of those families are and addressing them. We also want to acknowledge that doulas need culturally relevant support and mentoring. So again, as a doula, this can be, there's definitely not a lot of representation. There's becoming more. But we often are going into these, again, sort of systemically racist institutions and trying to support our clients. And so there's also a need for supporting doulas through especially those first few years as a new doula, in order for them to succeed, not just in the birth and delivery room, but also in their businesses. So again, trying to find the space where we're going to be supporting doulas in that way. Particularly for doulas who practice in remote and rural locations. Again, we're looking to launch this work nationwide, and we really see a spot where we could be supporting doulas who are maybe working alone in their communities or working, in rural locations. So that's what our doula and peer support initiatives have looked like so far. And I'm really excited to just keep meeting people and forming those relationships and seeing where there's alignment. There's a big uptake, obviously, right now, especially since COVID, with this information, with Black maternal health and reproductive justice. I know for myself, as a mom and as someone who's moving into that perimenopause, menopause phase and looking for information and seeing those gaps as well, and looking for, relevant and culturally competent care is so important. So, we're hoping to expand more and more. And just like many of you, I'm sure if you're in a nonprofit, it's like funding, right? So we're really going to be looking at pursuing more of that in the not too distant future. So again, just really busy working to expand our networks here in Ottawa, Toronto, and across the country. Some of the things that we've been going to include conferences, having connections and conversations with people in other nonprofits, other organizations. Fertility 101 webinar with the Black Fertility Agency. Again, fertility disproportionately impacts Black and racialized women and families. Often we're getting diagnosed late and they're not seeking attention. There's a stigma attached to it. So really learned a lot. And that was a great opportunity to kind of add to our repertoire in terms of, the issues that we're looking at. We've entered a partnership with My Third Bloom. There's the Black Maternal Health Conference in Toronto. Menopause Matters Conference. We're hoping to be able to get to that. We've also partnered as a community member with Black Women Aligned, who again put on events in Toronto this past April for Black Maternal Health Week. So we're really excited about the things that they're looking at doing and looking to learn more and build relationship with them. And then in terms of our community, sort of more here in Ottawa, again, Erica mentioned the AIDS Committee of Ottawa, the Black Fertility Agency, Rooted Birthwork Collective, who's been doing really fantastic work in the community already, as well as members of the Black Doula Society of Ontario, and as I mentioned before, Ottawa Birth and Wellness Center. So just like Toronto, we have a birth and wellness center here in Ottawa that's been operating for a number of years. And so looking at programming and alignment with them as well. So really excited and just, again, just looking to expand our network and our visibility in the circles.
To acknowledge the work and really represent the work, we decided to create a logo, which are going to be flying high from now on, that also is under the umbrella of CWCLN. So it is our public awareness branding logo. You see it behind everybody that's sitting here. It really is representing not only moms, but folks who haven't had a child yet or deciding, or maybe have probably lost a child. It encompasses a person as a whole, a Black birthing person as a whole, or folks who don't even decide that they want to have children. It just kind of encompasses everybody here. So of course, we've got the royalty in the purple, the Black as Black folk and Black people, and then the gold is kind of the warrior representation of the symbol and the awareness. So it was very important for us to really symbolize maternal health and reproductive justice, hope and healing and joy, and it encompasses everything that you see that somebody who's going through the stages of life. So this was really a part of why we were going to be doing it. And it is a logo that we want folks to share, right? And probably also use. And just kind of, this is something that we want to carry through, again, not only through the city of Ottawa, not only regionally, but across Canada, to be able to fly this flag high for Black maternal health. I'll pass it back to you, Danielle.
So we just wanted to do a little kind of quick and dirty by the numbers for you guys, just to kind of see what we've been up to. So 4 members of the working group, we meet 2 to 3 times a month. We had 30 bilingual survey responses. 100% of the survey respondents believe that culturally appropriate doula care is something that would benefit Black birthing people and improve birth outcomes here in Canada. So again, the messaging, it's not a huge survey, but just the messaging is still coming across that, yes, this is something that people are looking for and need. 61% of our survey participants were interested in learning more about becoming a doula or doula work. So again, in terms of our economic piece and being able to support people's interest, this was something that was really important to us. We wanted to kind of gauge that interest level. Research citations, 46. Thank you, Doula Deb. She did some great work collecting that data for us and briefing us all on the information that she was finding. We've had 5 municipal proclamations issued in cities across Ontario, proclaiming April as Black Maternal Health Month and Reproductive Justice Month. I'm sorry, someone is knocking at my door right now, and I'm just going to ignore them. We had 1 lighting commitment from the city of Vaughan. Thank you very much, who lit up the colors honoring Black Maternal Health and Reproductive Justice Month. We've had 1 meeting with MPPs, 3 community events, and of course, our 1 beautiful logo created. So maybe I'll pass this back to Sophia for our next steps, our fearless leader.
Absolutely. So some of our next steps, we are going to be advocating again, like we had said, to the federal government to be able to recognize April as Black Maternal Health and Reproductive Justice Month. So this is a continuation. So we don't have to keep asking. We just want it proclaimed and passed across the House of Commons. We are expanding our data. Of course, we're going to be lobbying with our partners, communicating with our partners to be able to have more data collection and to create better policy and system change, better resources, better programs, better services. We're going to be engaging more with the Francophone and rural communities. We find that vitally important. I think they're a missing link in the piece of the information that we need to be able to better serve Black birthing people, Black mothers, and Black families. We're going to also continue to assess community needs and develop a doula collective framework. As we start the Black Doula Collective, we are going to be gathering some information there. And of course, this is where the community comes in to be able to help support with that work. So that's going to be important. And of course, building partnerships right across Canada. Through and through, we know that, again, there's so many missing pieces here in Canada with the data. The desegregated data is just not there. We see our counterparts in other countries doing great work and they are light years ahead. We definitely want to create those strategic partnerships to be able to say that, locally, regionally, and nationally, we want to better serve Black birthing moms, families, and individuals. This is where we are. We are complete with our impact report. However, if anybody wants to raise their hands and if they have any questions, we will take questions at this point in time. Before we do the question period, we do want to say thank you to all of our partners. The impact report was sponsored by the Southeast Ottawa Community Health Center, and we want to thank them so much. They've been such a great support to us as a community health organization. They've stood with CWCLN practically near the beginning of the time that we started. The work that we've been doing since we've pretty much come into play since 2018. So we appreciate them so much. We thank our partners, Black Women Aligned and Third Bloom. They've been amazing to be able to have that extension across the region. And of course, thank you to our community partners, Somerset West Community Health Center, the AIDS Community of Ottawa, Co-Create, and of course, Ottawa Public Health, and those folks who are going to be coming in to be able to support us. We appreciate you. We do have questions, everyone. So somebody is asking, I'm wondering if OPH has numbers about how many pregnant women do not have primary care or prenatal care. I have heard this is a challenge for some agencies supporting pregnant clients. I'll pass this to Erica.
Thank you. Great question. Unfortunately not. We do not have that data because we do not work with all the pregnant individuals in Ottawa. So that's not data that we do have. We do have numbers around the clients we do support, those who need more support, and pregnant individuals who need more support, but that's just the clients we serve. It's not who is pregnant across Ottawa, unfortunately.
Super. Thank you, Erica. Somebody else is saying it is very important information on this session. Working at the AIDS Committee of Ottawa, they are particularly interested in exploring contributing factors such as the impact of discrimination faced by individuals living with HIV. Erica, did you want to talk about some of the upcoming stuff that we're having?
Yes, I love it. So we'll be doing a bilingual probably 2 sessions around STBBIs, the intersection of STBBIs and maternal health and postpartum as well. And I'm wondering who asked the question, but I'm working specifically with Fatima from the AIDS Community of Ottawa. We'll be happy if the person wants to kind of share the email, be happy to connect and seeing how we can add to that information in that session as well. But please, we'll be sharing the dates soon. So hopefully we can all, you can all join us on those sessions.
Somebody else had just commented that the Interdisciplinary Center for Black Health might have some insight and information on the research area. So we will definitely be checking in with them. There aren't any more questions thus far that I can see. We are getting thanks And, oh, I'm sorry, there are some more. We are rolling out the Black Health Plan at Somerset West. So it would be great to collaborate to inform our ACB clients on doula care services that are available in the community. Also, the OPRN are doing screenings on cancer, diabetes with Erica and Sophia. Yes, we are doing that. Thank you so much, Amoy. We appreciate you. And we appreciate that work that you've been doing. You do have a consulting organization, and of course, we are going to be definitely collaborating with you. I think that's everyone. Outstanding work team. Some folks are saying, so thank you so much. We appreciate that. There's so much work to be done, guys, and there's so many things that we are doing right now within community, collaborating with different organizations. One of the biggest things that we are advocating for, and I'm going to put this in, is of course funding. We absolutely need the resources and the funding to continue this work. So we are on a mission for applications and grants and looking for resources. So if there's anything, please send us an email to our contact information here or our website. Continue to keep in touch with us. We appreciate everybody for coming. I want to give an opportunity to Danielle, Kimberly, and Erica to say a few last words before we go. Go ahead, Danielle.
I just wanted to say that, again, in my role as the engagement and learning coordinator, if folks are interested in doula information and the ways that it can be helpful to their clients or the people that they're serving, the families they're working with, feel free to reach out. I'm happy to share information, give presentations, that kind of thing, so that more and more people become aware of, the support that is available. And I just want to say thanks so much to everybody for coming and, again, supporting the work, having the conversations, starting these relationships with us, and looking forward to doing more, causing more good trouble in the future.
Thank you, Danielle. Kimberly?
Yes, I just want to thank everyone. This was, a great initiative, and I'm very grateful that we're all here together focusing on such an important cause. So if anyone also wants to reach out and connect, I'm also available on LinkedIn. And yeah, I think we just got to keep pushing this conversation forward. So thank you once again.
Erica?
And I'm repeating everything everybody said. Really grateful to be part of this working group, but also kind of the spaces that are moving forward Black maternal health. Really happy to connect with Black women or femme health professionals to kind of continue to move forward the work, especially when it comes to cancer, diabetes, and cardiovascular health. And really hopeful for some of the contributions that we can make in the future. So yeah.
Thank you, Erica. Thank you so much, everyone, for coming. I want to give a shout out to Mediatrice. Mediatrice, everyone, if you don't know, is our newest person on the team. She is our logistics and communications assistant. So what we're talking about in advancing forward, especially in translation, French translation, Mediatrice is going to be here to help us. She was running the slides today, so I appreciate you, Mediatrice, for being here and supporting. And I thank you so much for everybody to come supporting us today, and of course supporting the work that CWCLN is doing. It is tough work, it is hard work, but we are here and up for the challenge. Again, reach out to us on all of our platforms. If you want to send me an email or any of the team an email, please do. Just check out our website, and thank you so much for coming. We appreciate you all. Have a wonderful afternoon.
Thanks, everyone.